We need gowns, we need gloves, we need masks.
Some of the lack of medical equipment to fight COVID-19 is a result of not enough supplies in the federal government's Strategic National Stockpile. The stockpile began in 1999 for national health emergencies. The goal? Store medication, vaccines, antidotes, and personal protective equipment, and ventilators, assisted breathing devices the government has struggled for years to acquire. Not only are there not enough supplies for the current outbreak, some of what's there has been stored so long it expired. That includes millions of N95 masks so desperately needed to protect healthcare workers.
Good morning. This hearing will come to order.
Policymakers seem surprised to learn the stockpile is failing to deliver.
We do need to take a look at how we fill that stockpile. Hopefully we learn from this.
Yet experts have been alerting about trouble with the stockpile for years.
We warned again and again and again.
Ellen Carlin was on a 2016 advisory panel for the CDC on how to improve the stockpile. The panel said the current model is not sustainable. There was a lack of clear goals and objectives for response, and the resources that American people are willing to commit are not sufficient to meet all of the expectations.
It's really unconscionable to me that Congress and a series of successive presidential administrations never really put the money into giving us the resources, the infrastructure that we need to deal with what we're seeing today.
A look at congressional spending for the stockpile shows a peak after 9/11 before funding dropped and stayed relatively flat for years. And even though the biggest use of the stockpile was for swine flu 11 years ago, the original focus was on a bioterror attack, not a pandemic.
The irony is that if this had been a smallpox or an anthrax emergency, we would have been much better prepared.
A Health and Human Services spokesperson told us the stockpile is meant to supplement state and local supplies. And HHS has been transparent that more supplies are needed, hence the request to Congress for additional funding. And Congress answered, giving $16 billion more for the stockpile, a massive cash infusion. FEMA says that products are going to all 50 states based on population and need. Patrick Terpstra, Newsy, Washington.